सततं संहारयत्यञ्जसा सृष्ट्वा दिव्यमहौषधीश्च विविधान् दूरीकरोत्यामयान् विभ्राणो जलनाचकास्ति भुवने पीयूषपूर्णं घटं तं धन्वन्तरिरूपमीशममलं वन्दामहे श्रेयसे वन्दामहे श्रेयसे वन्दामहे श्रेयसे। ॐ शान्ति शान्ति शान्ति।
Welcome, colleagues. My name is Dr. Gerard Buffo, and this is the first video in the Ayurvedic Health Education Advanced Program, one of our prerequisites to our advanced training. And I, along with my colleagues Hilary Garavaltas and Anusha Segal, welcome you to the program. And the prerequisite series is a series of 6 relatively short, videos ranging in time from 25 to approximately 40 minutes. That'll give you an overview of some things you've already learned and give you a taste of some things that we're going to cover in subsequent webinars, weekend seminars, and other trainings that we'll do over the course of the next year. The program is outlined at the website ayurvedichealtheducation.com, Hilary's website, and you can see and download the accompanying attachments to each of the videos, including our PowerPoint presentations and outlines for the lecture series. The textbook that I'm going to be using for my portion of this educational symposium is the Pathophysiology of Disease, an Introduction to Clinical Medicine, and this is the 7th edition by Gary Hammer and Stephen McPhee. And we'll send an image of this on the website so you can see. While this is a little bit more advanced than we need in reviewing Western thought in terms of clinical disease and creating an Ayurvedic counterpart, many of the chapters in this book will be germane to what we're learning in the weekend seminars and the webinars. So the outline of this 6 video series is today's lecture, video 1, is going to be overviewing some general concepts, brief summary of Ayurveda and Western medicine, looking at the similarities between the two sciences and where we're going to draw similarities in the course of our lecture series. And we're going to close with an emphasis on how Western medicine looks at pathological basis of disease and how we're going to grow that into the Ayurvedic model. The second lecture, which will be delivered by Anusha, will look at Agni and the role of digestion, including some abnormal views of that. The third lecture is going to be doshas and dhatus and the malas and the importance of the energetic basis of Ayurveda. The fourth lecture is going to be the etiology of disease, looking at Shrotamsi and deviations from normal dhatu development. The fifth lecture, which I will deliver, is looking at diagnostic tools. And in order to have a good working knowledge of Western medicine and how to apply that to our Ayurvedic model, we're going to look at imaging parameters, we're going to look at laboratory tests, and we're going to give a brief summary of medical terminology, all of which will be delved into much more in-depth in the weekend seminars and the webinars. And the 6th lecture will be delivered by Anusha, which will look at the physical examination and refinements of that. So to begin our lecture today, we're going to be looking at, the first is an overview of Western medicine, Ayurveda. And traditional Indian medicine, our Ayurvedic model, is one that's based on observation, energetics, alignment with nature, dietary lifestyle, herbal remediation, and the tincture of time. Our primary physician, Charaka, in his Samhita, teaches us that not only is Ayurveda a science for practical living, it teaches basic cause and effect, and it creates harmonious interactions and balance between the body and the mind. And the laws of Ayurveda are based on those that were handed down through the rishis, but also observed on the interactions of nature. The approach is individualized, and we evaluate imbalances through an elemental understanding. So the Panchamahabhutas are the basis of Ayurvedic understanding of imbalances. And Charaka says in his Samhita, chapter 12, paragraph 8, talking about the microcosm-macrocosm relationship, that the human body is the crystallization of the universe, and we contain all 5 of the great elements. He says that the energetics of the body prompt all actions. They restrain and impel mental activities, coordinate all sense faculties, bring about compactness of tissue elements, prompt speech, create the indriyas, or the senses, mold the shape of the embryo, control the digestive fire, and the doshas. So that's on the individual level. But then he also states that on the macro level, and in the universe, the energetics of our world sustain the earth, kindle fire, bring about compactness and movement in the sun, moon, stars, planets, create clouds, showers of rains, flowing of rivers, shoot forth plants, classification of the seasons, as well as the 5 Mahabhutas, manifesting the shape and size of the products of the 5 Mahabhutas, bring about hardness and dryness in grains, bring around about transformation everywhere. In addition, Charaka talks about the power and the interactions of the energetics of the body. The interactions and the movements of the energies, or the doshas, the vata, the pitta, and the kapha energy, and looking at them where they originate in the gastrointestinal tracts, and the etiology of disease is based on movement out of the GIT into areas of weakness or kavigunyas. Western model, looking at an image of Hippocrates examining a small child here, is Greco-Roman in origin, some thousands of years after, Charaka and his Samhita. And Hippocrates, was a natural-based physician, and he said disease is caused by some body alteration that has natural sources, and he was the first clinician who said that science is the basis of disease, and disease is not caused by superstition or by gods, which created him as the father of Western medicine, because he started using a scientific model. He was birthed 460 BCE and lived in Kos. And he took a passive approach to treatment of disease, despite the fact that he diagnosed along scientific lines. He felt that medicine is food, and food is medicine. Lifestyle is healing, and lifestyle can be disease-causing. He created a clinical examination. He examined bodily fluids and looked at the organ systems of the body in a very systematic and almost mechanical approach. Nowadays, we've evolved into a more technical type of diagnosis and treatments. Diagnosis only after laboratory tests are done and imaging examinations are done, and using chemical agents, as you see on the screen, through treatments as well as surgical intervention. There is debate on its efficacy, in terms of Western medicine nowadays, since we see an incredible increase in chronic diseases and lack of attention to disease prevention. In about 1810, the famous Philadelphia physician Samuel Hahnemann, who you now see on the screen, coined the term allopathy. And allopathy is an argument that Western medicine was treating against the pathology, not looking at the whole person, but just treating against the pathology, treating opposites. And in that area, both Ayurveda and Western medicine agree that we treat opposites in order to cure. He was the founder of homeopathy, which is a reasonable branch of medicine, but the term allopathy still stands as pejorative against Western medicine. So what are the things that we really embrace about Ayurveda? Ayurveda is a prevention-based medical system, the oldest continuously practiced form of medicine on the planet. And the definition of health, according to Sushruta, is samadosha sama agnicha samadhatu malakriya prasana atma indriya mana swasta idya pidyate. And he emphasizes in that definition it's balance, balance, balance that creates health. Ayurveda also prides itself on early identification of disease. The etiology of disease can be broken down into doshic imbalances, doshic aggravation, doshic migration, and doshic manifestation. And in Ayurveda we can identify disease during early prodromal periods as doshas start to get aggravated before they move out of their homes. And Ayurveda also bases its therapeutics on nature, changing diet, food management, living according to temporal variations, utilizing lifestyle changes as well as natural herbs, plants for treatment. And additionally, they look at the individual as a unified whole as their approach to treatment. So we treat not only the physiology, we treat the mind and the spirit as a unified approach to the individual. Western medicine is excellent at treating disease after it manifests itself and is in advanced forms, particularly acute diseases. Surgeries for acute traumas, cancers, and the like are really a positive growth in Western medicine. They pride themselves on being able to eradicate disease. So Western medicine, the emphasis is always on cure. Less emphasis on prevention, less emphasis on natural management. But eradication of disease is the goal all the time. Western medicine has developed incredibly powerful diagnostic tools, particularly imaging and laboratory tests, and therapeutic tools, which we've already discussed, which we'll discuss in much more elaborate detail in future lectures. In addition, they've taken a systems approach to look at the human body. And by systems, I mean functional systems and anatomical systems, such as the gastrointestinal system, the cardiovascular system, the central nervous and peripheral nervous system, which are based on structural and functional pathologies. This has pluses and minuses. The pluses are that you can have specialists that can develop a unified approach to treatment of that specific pathology involving that system, but it puts blinders on the clinician in terms of looking at the whole person. So the systems very rarely overlap in any good way. Also, Western medicine prides itself on eradication, doesn't view healing. Healing doesn't mean the damage never existed. It means the damage never controlled our lives. It doesn't control our lives anymore. So all patients can be healed. Not every patient can be cured. The cure is to be free of disease, or to eliminate disease. Healing means oftentimes being able to live with disease. So let's take a break here, pause for a second, and just kind of look at the typical patient and how Ayurveda and Western medicine might work together in treating a patient. So we have a typical 62-year-old male patient who presents to his clinician with acute, severe, crushing chest pain and having a heart attack. This patient would be whisked to the hospital and have an emergency angiogram and put on blood-thinning agents, and a stent would probably be placed in one of the heart arteries to open up the artery that may have closed down as a result of cholesterol plaque buildup in the artery or inflammation. So the West would be good at treating that acute management of the heart disease, Ayurveda then would be available to promote lifestyle changes to prevent disease worsening for potentially reversal of disease by looking at diet, lifestyle, and herbal management. So the two can work in tandem with each other in order to help the 62-year-old patient who's suffering from a heart attack. So having said that, just this brief overview of Ayurveda and the strengths and powers and beauty of Ayurveda and Western medicine and the strength and powers and beauty of Western medicine, where we're going to cross these over will be in our weekend seminars and our webinars looking at how we can utilize both systems to maximal advantage and speak the language and help our patients treat disease. In order to understand disease and the language around disease, we have to understand Western pathology a little bit more in depth. And Western pathology has two schools of thought when it comes to pathological basis of disease. The first is a system of pathological overview looking at the systems of the body. And pathology is based on each individual system, and we'll go into those a little bit in a couple of minutes. The second system looks at etiological basis of disease. So what is causing disease? What is the root cause analysis of disease? Which fits a little bit better with the Ayurvedic system management. So in a systems approach to disease, I'm going to start with just briefly talking about the gastrointestinal system. And the gastrointestinal system is the organ system whose function is process and transportation of food products and defense against outside invaders. It involves the mouth, the tongue, the salivary glands, the esophagus, the stomach, the small and large intestines, rectum and anus, and as secondary organs which participate in the digestive process, the liver and pancreas primarily. The gastrointestinal system is intimately involved with the nervous system because the enteric nervous system, which controls the motion of the intestinal system, is an offshoot of the peripheral nervous system. It produces a significant amount of serotonin and is oftentimes dubbed as the second brain. So a system's approach to the gastrointestinal system oftentimes overlaps somewhat with the nervous system. The cardiovascular system is the next system I'd like to just talk about. Includes the heart and the lungs, intimately involved with each other, and the great vessels. And the function of the cardiovascular system is transport and nourishment, so respiration, tissue, health. The nervous system is the next system, and the nervous system includes the central nervous system, which is the brain and the spinal cord, the peripheral nervous system, which is all the peripheral nerves and nerve ganglia, the autonomic nervous system, which is the sympathetic and parasympathetic nervous system, and the enteric nervous system, which is part of the gastrointestinal tract and intimately involved with both systems. The nervous system is involved with control and balance. So neurotransmitters and neural impulses control and balance many systems of the body. The next is the musculoskeletal system. And the musculoskeletal system is your muscles, your bones, joints, ligaments, and tendons. And the musculoskeletal system is mobility and protection. Protection, particularly the cranial vault and the ribs for the vital organs. So the musculoskeletal system, bones, joints. The endocrine system is the next system, and the endocrine system is intimately involved with the balance in the body and homeostasis. And this really fits well with Shruta's definition of health, the sama dosha, sama agnicca, sama dhatu, the balance in the body. And it involves primarily the endocrine organs, which starting from the head and working our way down, is the hypothalamus, the pituitary gland, the thyroid, the parathyroid glands, the thymus, the adrenal glands, and the gonads, the testes and ovaries. And these have a very delicate feedback balance that controls homeostasis, it controls many body systems and processes. The next system is the genitourinary system, which is the kidneys, ureters, and the bladder. It also involves the genital organs in the male and female genitourinary tract. And its function is water and fluid balance, maintenance of fluid integrity in the body, salt balance, and reproduction. Next system is the integumentary system, which is the skin. The skin is the largest organ of the body, and its function is protection and temperature regulation. And finally, the last system of the body, although there's a lot of overlap here, is the mental system of the body. It controls many functions of the body, the autonomic type of functions of the body, including breathing, heartbeat regulation, but also the higher functions of the body, the executive functions, processing of thought and analysis, memory, and emotion. The great philosopher said, cogito ergo sum, I think, therefore I am, and I think in Ayurveda we would probably say that needs to be tempered a little bit because thinking is not the only thing that we are. Now if we take a switch over and look at the etiological basis of disease, we start with congenital. And etiological basis of disease, congenital, are diseases that you were born with. Genetic diseases, inborn errors of metabolism, structural or functional abnormalities that are related to genetic aberrations or abnormalities. Some of those might be such diseases as hemophilia, Down syndrome, trisomy 21, and similar diseases. The next would be infectious disease. And infectious disease are many subcategories of infectious disease. The most common we talk about are bacterial infections. And bacterial infections include such etiologies as Staph aureus, Streptococcus. Everyone is always dreading the antibiotic-resistant organisms, particularly MRSA nowadays. Viral diseases such as herpes and others in the same family. Then we have parasitic diseases, and parasites include worms and other flagella. And finally we have fungal diseases, which are things such as candida, and related diseases of fungal origin. The next is a large group of diseases, inflammatory diseases. And inflammatory diseases are all diseases that end with itis. Itis is the suffix, and when we talk about medical terminology, it means inflammation. And usually it's the result or reaction of the body to something invading it or something going wrong. And it can be appropriate or inappropriate. We talk often today about autoimmune diseases. And autoimmune is the self attacking the self. The most common etiology for hypothyroidism nowadays is autoimmune thyroiditis or Hashimoto's thyroiditis, which is an inflammatory disease. The next is a category which I like to call metabolic diseases. And there's a whole host of metabolic diseases. The most common one is the abnormal metabolism of sugar and diabetes, either diabetes 1 or type 2 is the most common diagnosis under metabolic diseases, but other diseases, such as PKU, phenylketonuria, which is an inborn error of metabolic disease are also in this category. The next large category is neoplastic disease. And neoplastic diseases are diseases of tumors, cancers, and they can either be benign or malignant. And benign tumors can be not so bad, malignant tumors are generally bad players. Why I say benign tumors cannot be not so bad, benign tumors generally do not spread other places, but you can have a benign tumor growing in a bad spot, you know, in your middle ear or your inner ear, you know. Malignant tumors are malignant because they spread to other places of the body and oftentimes cause death. The next I call category of diseases known as traumatic. And traumatic diseases are diseases either of direct gross trauma or microtrauma. So we can have gross, so you have a car accident, you break your leg, or microtrauma, you have an aneurysm, an artery that ruptures. You know, that's an internal traumatic disease. And both of those are treated similarly as trauma. Next is degenerative disease. And degenerative diseases are, just as the name implies, diseases where body parts wear out. You know, they can be organ, they can be musculoskeletal, they can be anything, any of the systems diseases. But typical ones would be the arthritises or arthropathies. And arthritis, you can see, has that itis at the end of it, which is the inflammatory disease. One that some authors will say is a degenerative disease, and there's been a lot of press on it lately, is Alzheimer's disease. Whether or not this is a degenerative disease or a metabolic disease has a lot of debate, and we'll talk about that, you know, in future lectures. So, to sum up what we've been talking about today, we've looked at a combination, a symbiotic model of how Ayurveda and Western medicine can work together in a healthy way, that being primarily looking at the value Ayurveda has in prevention of disease, early etiological diagnosis of disease, therapeutic management that prides itself on natural remedies and allowing the body's own ability to heal itself, and Western medicine's strength on treating disease that's already aggressive and advanced, in the acute phase treating disease, a wide toolbox full of sophisticated laboratory and diagnostic imaging tests, and finally its ability to look at the body in organ systems for expertise. So, having said that, and we looked at, you know, two pathological systems, what I'd like to close with is to look at several disease entities and see how they fit into those certain etiological and system formats. And if you go to your next slide, titled Questions, the first one is acute pancreatitis. So, acute pancreatitis, and we'll abbreviate it AP here, under a systems approach, what organ system would it involve? Well, that would be the gastrointestinal system, because the pancreas is one of the accessory organs of the gastrointestinal system. If we look at the etiology, it's an itis, so it would be an inflammatory disease of the pancreas. Occasionally, it can be infectious. In the early part of the 20th century, the most common form of pancreatitis was related to the mumps virus. And how does this generally present? It presents frequently with abdominal pain, laboratory abnormalities that include abnormal lipase and amylase, oftentimes associated with a history of alcohol abuse or steroid use. Let's take another one. Rheumatoid arthritis, we'll abbreviate this RA. Under the system approach, in your own mind, take a gander at what that would fit under. And I would suspect you all said musculoskeletal system. And again, the etiology is an itis, so it's inflammatory. And how does this present? This presents with joint pain, swelling, primarily involving the proximal joints, the joints closest to the body, not the distal joints, the smaller distal joints. Oftentimes has a family history. Another would be lung cancer. The system would be the cardiovascular system. The organ is the lung. The etiology would be neoplastic. And how do these patients present? They usually present with cough, blood in their sputum, which is known as hemoptysis, and most commonly these have a past history of cigarette smoking. Although lung cancer does occur in non-smokers. Osteoporosis, again involves the musculoskeletal system. It would be a degenerative. Etiology, as bone mineral is being leached and lost out of the bones. It has a metabolic component to it because we're losing calcium primarily and some phosphate. This is a silent disease, so oftentimes has no presenting complaints. Rarely would you have, a fracture, sometimes in the spine, vertebrae, or fracture in someone in their long bones in old age. Oftentimes this is diagnosed by screening tests, an exam known as the DEXA bone density scan. These patients are generally very small stature patients, and there's oftentimes a family history of this. And the last one I'd like to talk about is stroke. Also in the cardiovascular system, usually involving the central nervous system. And this is one of those that's kind of interesting. When you think of traumatic disease, you think of car accident and broken bones. But this is a traumatic disease as it involves an acute event internally, trauma to a blood vessel that goes to your brain, and results in a significant negative outcome. And how do these patients present? They often present with paralysis, facial droop, and oftentimes have a pre-existing condition of hypertension. One thing that does worsen their likelihood of developing this is the presence of cigarette smoking in their history. So this is kind of a brief look through of how to evaluate pathology from a systems approach and from an etiological approach, and how we can classify them. For most of our treatment, we're going to be looking at people from an etiological approach, but for most of our lecture series, we'll be approaching pathologies from a systems approach. In closing, I just want to remind us that our goal here is to treat patients. And the definition of Ayurveda is the science of life. And Dr. Robert Svoboda also says it's the science of longevity. Well, our goal is not to necessarily prevent death, it's to improve quality of life. And I'm reminded of a story about one of the oldest living World War I veterans. He was interviewed by the medical staff at the VA hospital, and they asked him, "What do you attribute your longevity to?" And his response was, "Well, I've eaten well, I've taken good care of myself." And he said, "But you know, I've had chest pain just like the next guy, and I was probably having a heart attack. And I've had weakness on one side of my body and inability to remember things, and probably was having a stroke." And he said, "You know, sometimes when I go to the bathroom, I see lots of blood." He said, "But any time those things have happened, and I thought I was dying, I just didn't." So as Ayurvedic and Western clinicians, our goal is to preserve quality of life. Not necessarily to keep people living longer, but to keep people living better. And I think the best way to do that is with a symbiotic, combined approach to the patient encounter. In our next lecture, Dr. Anusha will be talking about Agni and Ama, reminding us of the 4 stages of Agni: Vishama, Tikshna, Manda, and Sama, and the role of Ama in the etiological basis of disease. So we'll see you at the next lecture. Thank you for participating.